Okay, before I walk into the room, I will now begin to look at my charting and make sure that I have the right patient and I have all my medical equipment ready. So now I am gonna walk in. Privacy. Hello, my name is America. I am your nurse today. I'm gonna wash my hands, put my gloves on. If you can, please verify your name, date of birth, and age. Okay, and can you tell me where we are right now? And do you have any allergies? Any pain from 1 to 10? None? Okay. I can see that my patient is orientated and conscious. He is responding to all of my questions correctly. I can see by his facial expressions that he's in no pain. His mood looks like he's comfortable, and I don't see any accessory muscles when he's breathing. His skin looks good for his ethnicity. Now I am going to take his height and weight to check his BMI, and I can also see that there's no medical equipment, no oxygen concentrators with him, and I don't see any wounds or ostomy bags. Is there anything that is on you that I cannot see right now? No? Okay. And now I am going to ask you if I can take your vitals. I will be checking your blood pressure. That is 120/80. Pulse is around 60. Respirations are around 18. Temperature 98, and oxygen around high 90s. That is all very normal within range. I will not document that. And now I'm going to begin to assess your skin. I'm going to take a look at your head first. I'm going to inspect it and see if there's any wounds, scars, no infestations. Hair distribution looks good, normal. Now I'm going to palpate. Please let me know if there's any pain or tenderness. None detected. Now I am going to ask you if you can take your shirt off. Okay, and I'm going to feel your skin. Body temperature feels normal within normal body temperature. Skin and texture feel normal. It's moisturized, no dryness, no redness. Don't see any discoloration, no stenosis or jaundice. I'm gonna just take a look at your back as well. Your skin temperature. I'm gonna palpate for any lumps and percuss. And I'm gonna specifically percuss your coastal vertebral angle for any tenderness, any kidney pain. None. Okay. And I'm going to take a look at your arms, no exploration. Like I said, there wasn't any wounds or scars. Your fingers look okay, no clubbing in the fingernails. Capillary refills are +2. And now I'm just going to check if you're dehydrated, so I'm going to pinch your clavicle for any denting. No dehydration. Now I'm going to take a look at your legs. Don't see any swellingness or redness, no edema. Like I said, no discoloration, no stenosis or jaundice. For your feet, I'm going to check if there's any broken toenails, no clubbing, and capillary refills +2. I can have you put your shirt back on now. And now I am going to be checking your neck. If I can have you look up, I'm going to feel for your thyroid gland. Don't feel any enlargement. I'm going to feel your lymph nodes. Please let me know if there's any pain or tenderness when I am palpating your lymph nodes. If I can have you look side to side, no jugular distension. And if I can have you look up, down, side to side, good range of motions. And now I'm going to take a look at your eyes. eyebrows and eyelash hair distribution looks good. Face looks symmetrical. Eyes look aligned. Don't see any redness or swelling around the eye. No drooping or sagging. And I will take a look at your sclera. Clear part, no redness, no irritation. Now I'm going to take a look under your eyelid. No redness, no swelling, and your bulba conjunctiva looks normal as well. No redness, any irritation, no. And now I am going to be testing your ocular motor. I'm going to be checking your pupil for constriction and dilation. But before that, I'm going to inspect your iris and then check your pupil response. So here comes the light. Pupil response is immediate. And for your trochlear and abducent, I will have you look at my pen light in 6 different directions for eye movement. 1, 2, 3, 4, 5, 6. Good. That looks very normal. And now I am going to move on to your ears, nose, and mouth. And ear placement looks normal. They don't look deformed. And now I'm going to palpate your pinna, tragus. Any pain or tenderness when I did that? None? Okay, now I'm going to take a look at your tympanic membrane. No ear discharge detected. And now I'm going to do your 8th cranial nerve, which is your auditory. And I'm going to stand behind you on each side, each ear behind you. And if you can, please repeat the number that I'm saying. 3, 3, okay, good. And now I'm going to take a look at your nose. Nose looks symmetrical, aligned. And now I'm going to take a look at your nasal mucosa. No pain or no redness or swelling. No nose discharge. If I can have you plug one nostril and then the other. Okay, and breathing, any difficulty breathing? None? Okay, and now I'm going to take a look at your mouth. Lips look nice, rose pink. Teeth and gums look healthy. Tonsils don't look swollen. And now for your hypoglossal nerve, I will have you say flight tight dynamite, and I'm going to get my tongue depressor. If I can have you say that, flight tight dynamite. Okay, good. Swallowing is good. And for your glossopharyngeal and vagus, I am going to have you take your tongue out, and I'm going to get my tongue depressor, and if I can have you say ah. Okay, uvula response, rise and fall is good. Midline tongue looks healthy, no redness or irritation. And now we're going to move on to our respiratory system. Have you had any surgeries that has affected with your breathing? None? Or any trauma? None? Okay. Now I will have you take off your shirt again, if that's okay. Once again, I'm going to take a look at your anterior, posterior side of your chest to feel any lumps around your lungs. No lumps. That's in palpating. And then cusp, any pain or tenderness? None. And then again, under your back, any deformities or abnormalities, keep inspecting. Palpate, cusp. Okay. Now, I will listen to your lungs. 10 different areas, front and back. And I deep breaths. 1, 2, 3, 5, 6, 7, 8, 10. Now you're back. 1, 2, 4, 5, 6, 7, 10. Didn't hear any crackling or wheezing. Lung expansion sounds good. It sounds like there's no fluid. And now I am gonna assess your cardiovascular system. So I'll have you with your shirt off again. And before we take off your shirt, if I can listen to your carotid arteries, rhythm and rate, it's normal. I'm gonna listen for any bruits with my both side of my stethoscope. No bruits detected. And now I'm gonna listen to the 5 areas of your heart. 2, 3, 4, 5. Heart rate is normal, no irregular heart rhythm, no murmurs detected. And now we're gonna move on to your abdomen, so we'll just have you without your shirt off again. Gonna expose your stomach. I'm gonna take a look at it from 2 different angles. Here. Stomach movement looks good. It looks normal, no accessory muscles being used. I don't see any wounds or scars, no ostomy bags, and umbilical cord looks in the midline. And now I'm going to listen to the 4 quadrants of the abdomen, starting with the lower right. And I'm going to listen to the abdominal aorta as well with the bell side. Okay, everything sounds healthy and normal. And now I will palpate in a circular motion. Please let me know if there's any pain or tenderness. And I'm feeling for any inguinal hernias. And now I'm going to percuss the 4 quadrants. Any pain? None? Okay. Now you can put your shirt back on. And we're going to move on to our muscular skeletal. If I can have you stand up, walk across the room, and have you walk with your heels and then your toes. It seems like good coordination. Looks like no limbs are hurting. He's able to move easily. And now if I can have you just stand, arms together, feet together, close your eyes, and now I'll stand near you, check your balance with the Romberg's test. Okay, balance is normal. And if I can have you sit back down, I'm going to check for your joints. Any pain or stiffness? None? Okay. And now if I can have you sit at the edge of the bed, we're going to do range of motions. Can I have you lift your arms up, down, side, and legs out, in, ankles in and out. Okay, looks good, normal. And I'm going to do 5 strength tests on you. If I can have you squeeze my fingers, push your hands out, push them in, legs, push them up, push them out. Okay, good coordination. And now for your, I am going to check your radial and pedal pulse. So radial, pedal, since I have you sitting on the edge of the bed. And now, if I can test I'm going to tell you these 3 words, and if I can have you repeat them at the end of the assessment, the ABC, okay? And then I am going to, since I still have you sitting on the edge of the bed, I'm going to test your tendon reflex. So I'm going to test your patellar tendon, bicep, and brachioradialis, okay? And now, if I can have you stand back up and have you balance on one side of your foot and then the other, okay? And then for your upper coordination, if I can have you touch your nose with your fingertip and then touch my fingertip, okay? Good upper and lower coordination. With my cotton ball, now, if I can have you close your eyes and tell me where you feel this. Correct, that is in your leg. And then what about back here? Correct, that's on your back. And now with my tongue depressor, can you close your eyes again and tell me if this is the dual or sharp side you feel? That's correct, that's the dual. Okay, and then now I'm just gonna finish off the cranial nerves. So the olfactory nerve, I will have you smell this. That's correct, that is coffee. And then for your second, your optic, can I have you rate that across the wall? Okay, good vision, normal vision. And we had already tested your ocular motor, trochlear, abducen. So now I'm gonna move on to your trigeminal. And if I can have you close your eyes and clench your chin and your cheeks and your forehead. Okay, good nerve response. And then for your facial, can I have you do a frown and a smile? Okay, so your muscles are reacting. And we just tested your facial, and then we've done your auditory when I tested your hearing, and we've also done your glossopharyngeal and vagus when I assessed your mouth. And for the spinal accessory, I had assessed it when you were standing up and walking, so I can see that you're moving very well. All of your muscles and bones are okay, and your hypoglossal, we also did that when we assessed your mouth. And now if I can have you repeat those 3 words that we said earlier, ABC, okay? Or words, thank you. And that is all. I will document all of my findings, and I will now remove my gloves, wash my hands, gather my equipment, and have a good day.